Emphysema!
The destruction of the alveolar walls that causes permanent abnormal enlargement of the air spaces. Here, you can see a normal lung with the correct alveolar expansion. To the left, you can see a patient's lung with emphysema. This permanent enlargement of the air spaces causes a deficit in the oxygen exchange. Emphysema, along with chronic bronchitis, fall under the umbrella term COPD. COPD is characterized by the inflammation and destruction of alveoli that causes decreased gas exchange, collapse of lungs during expiration, and air trapping. During an exacerbation, the inflammatory process worsens, resulting in increased mucus production, airway narrowing, and further destruction of alveoli.
This is our emphysema patient currently in tripod position, which is a physical stance that emphysema patients classically use when in respiratory distress. The tripod position is when the patient is sitting or standing and they lean forward, supporting the upper body on another surface. Looking closely, we can see that an emphysema patient also presents with clubbing fingers. This is when the fingers become rounded at the ends, and it is due to the low blood oxygen levels in advanced edema patients. As we zoom in on the barrel chest, which is a large round thorax and is often seen in emphysema, if we zoom in closer, we can see the pursed lips of a patient with emphysema. This is demonstrating when they are having trouble exhaling the air out and push their lips together.
Occasionally we see a decrease in weight with emphysema patients. This is due to a loss in appetite.
Good morning, emphysema patient. We have your lab results back. This morning when we took your pulse ox, it was 90%. We usually like to see for an emphysema patient around 90 to 93%. Your arterial blood gas test came back and shows that your PaO2 was 74 and your PaCO2 was 46. We would like to see your PaO2 closer to 80 to 100 and your PaCO2 around 35 to 45. With your chest x-ray, we can see that there is hyperexpansion of your lungs as well as a flattening of your diaphragm. With all the test results, your physical appearance, we see positive signs of emphysema.
Hi, emphysema patient. I'm here to assess your lungs. Sit up and take a deep breath for me. Again. Wow, those lung sounds are very hard to hear.
Diminished lung sounds are a common occurrence in emphysema patients.
I'm going to listen to your lungs a little bit more. I think I hear a lot of crackles and wheezes in there.
Crackles and wheezes are very common as well.
All right, patient, it's time for your yearly influenza vaccine.
Vaccinations are a great way to help prevent airway inflammation. The bacteria and viruses in the flu can cause your airway to become inflamed. By getting your vaccine every year, you can help prevent inflammation in your airway.
I feel like I'm short of breath.
You probably need to sit down.
Yes, please.
Here you go. You take a rest for a minute.
I'm going to get into the tripod position now.
Okay.
Oftentimes, emphysema patients experience shortness of breath due to very short periods of exercise.
Smoking is the #1 cause of emphysema and COPD. Smoking cessation is associated with a reduced risk of COPD exacerbation, with a degree of exacerbation reduction related to the duration of the cessation. Guidelines support smoking cessation as the single most effective means of reducing COPD progression, regardless of disease status. Give me that cigarette. You need to stop that. So, patient with emphysema, I'm here to talk to you about a proper medication regimen. It's very important that you stick to the prescribed times and dosages for your emphysema and COPD medications. One of the most important things that you'll be using is this bronchodilator, albuterol. This is going to be your rescue inhaler. How you use this is give it a couple good shakes, you make sure the cap is off, you put it up to your mouth, and you press down. Shh. How do you feel now?
I feel great.
Well, good.
Is there a cure?
Well, the expected outcome is that there is no cure, but you can treat your symptoms. The ways you can do that is to stop smoking, get your vaccines, use your rescue inhaler when needed, and always remember to adhere to your medication regimen.